to our seminar tonight on diabetes, signs, symptoms, and solutions. And I'm being joined tonight with my friend and colleague, Dr. Ira Bernstein. He's not connected to the Bernstein program for any of you who thought maybe he was. Ira and I have been working together for several years now. I'm a nutritionist and I've been working with metabolic balance, but I'd like to give a little bit of an intro into Ira. Ira Bernstein is a family physician who's been practicing in Toronto for over 29 years. He graduated from the University of Toronto in 1990 and has completed his residency in 92 in Toronto. He provides newborn care to the end-of-life care in his family practice. He's passionate and has an interest in nutrition for several years, and he has served as a medical advisor to Metabolic Balance Canada, providing support to all the coaches. On his spare time, he tries to compete with me on the Peloton, but we always have fun about that. He does inspire me to do different classes because I'm kind of a creature of habit, but I have broken away and done the Beyonce classes thanks to Ira. And when there's no pandemics, he enjoys travel. We also got to travel back and forth to Germany, where we have done some work. Very excited to have all of you here tonight. It's a subject close to my heart, very close to Ira's heart. And what we wanted to do tonight was first have Ira speak to you about what diabetes is, and then we're gonna talk about a simple solution, and then we're going to open up to questions. If you have any questions through the webinar, you may want to write them down so that we can actually talk about them later. And I'd like to welcome all of you tonight. So it's great to have such a large group of people joining us from all over. And hopefully you're going to find that this is a very informative and wonderful presentation. So Ira, I'm going to share the screen with you, and I'm going to allow you to go ahead and begin.
Okay, Jane, thank you for the introduction. Although it appears that I'm in a lovely forest, I would have to say I wish I was right now. I am in my home office in Toronto. Anyways, it's a pleasure to join you all tonight, and I'm just going to give you a brief overview, not on a very in-depth discussion, but sort of providing some basic understanding of diabetes, its prevalence, and the significance to society, our healthcare systems, and an impact on life, and why it is so important to be aware and to be able to diagnose and to be able to manage this, and even possibly reverse it with the right steps. So I'm going to be talking about some of the signs, symptoms, and then Jane's going to be getting into some of the solutions from a nutritional basis. My my function as a family physician, my expertise is more on the medical management of diabetes, and I would say it's actually a good time to be managing diabetes because we do have some really great medications to work with. It's actually a lot better than it used to be. But that is not in place of nutrition. Really, the first thing that I do when I have a patient that's been diagnosed with diabetes is refer them for nutritional counseling. This is standard care. So this is key. Anyways, we're going to go on to the next slide and give you a little bit of an overview. So just to give you an idea of the prevalence, as you can see here, approximately 463 million people around the world presently have diabetes. And these are cases that we know of. There are a lot of hidden cases that we don't know, people that have not been diagnosed that have either diabetes or pre-diabetes. And so this has a huge impact on the life, health, and longevity of our population. Unfortunately, the numbers are growing quite dramatically, as you'll see in some of the data that we'll display a little bit later. Next. So first, what is diabetes? On a simple perspective definition, diabetes simply means to make a diagnosis, a fasting blood glucose of 7.0 millimoles per liter on more than one occasion is the diagnosis of diabetes. So it simply means elevated blood glucose. So when I see patients in my office, we're looking at these parameters when we're doing blood work. So if I see a patient is 7.0 or more fasting, that's diabetes. If the fasting sugar is 6.1 to 6.9, then that would be considered pre-diabetes. So below 6.0 on a fasting sample would be non-diabetes. One of the other terms that we use in the diagnosis and follow-up of diabetes is a term called glycosylated hemoglobin, or hemoglobin A1C. So in that, we have ranges of normal. So we aim for a normal hemoglobin A1C would be under 6%. At 6.5% would be diagnostic of diabetes. So these are the numbers that we use on a regular basis to follow patients who have diabetes, whether it's type 1 or type 2, in order to determine whether their management is controlled or not. Next. So what are the symptoms, signs and symptoms of diabetes? Here's a list. You may have heard of many of these. Someone who presents with excessive thirst, frequent urination, changes in the skin, darkening of the skin. Often there's an association with elevated blood pressure, also known as hypertension. Most patients, not all, have weight gain, but some individuals may have weight loss. And there are other symptoms. You might have fatigue. If the sugar is elevated enough, there may be blurred vision. There may be mood changes. There are all sorts of symptoms. But what you really need to know is many patients have absolutely no symptoms at all. When I make a diagnosis in my office of diabetes, and I would have to say that during this pandemic, when patients have been not eating optimally, and there's been a lot of weight gain, there's been a lot of anxiety, and what I have seen is a higher incidence of diagnosis of diabetes, and many of these patients absolutely have no symptoms whatsoever when I see them in my office, do their blood work, and I have to inform them that they now have diabetes. Because when someone has excessive thirst or frequent urination, your sugar has to be really quite elevated for that to happen. If your sugar is mildly elevated, if it's running around 9, 10, 11, in general, you're not going to have any symptoms at all. And basically, the diabetes is going to be doing its damage over time before you might even know that there's a problem. Next slide. So, what are some of the causes? You may have heard the term insulin resistance. So, what does this mean? Most individuals with at least type 2 diabetes have insulin resistance. What this means is they have adequate levels of circulating insulin in the bloodstream. Insulin is a hormone. Insulin causes glucose, which is energy, from the bloodstream to be transported into the cell. You don't want it hanging around in the bloodstream. It needs to be brought intracellular in order for it to be effective. So with insulin resistance, you have insulin that is not, you have cells that are not responding properly to the presence of insulin. So you require higher and higher amounts of insulin in the bloodstream in order to bring the glucose into the cell. And often the insulin resistance is associated with obesity. As one becomes more obese, particularly central obesity around the waist, this increases the susceptibility to this insulin resistance. There are also significant genetic factors. So often we see diabetes, type 2 diabetes, that runs within families. If you have two parents with type 2 diabetes, the likelihood of their children developing diabetes, particularly if they gain weight, is going to be significantly higher. And then there's lifestyle and nutrition and exercise that are associated with elevated blood glucose and diabetes and pre-diabetes. So that's why we're all here today, to learn about this and how to prevent it and how to treat it from a nutritional basis. Next slide, please. So why do we care? We need to care because diabetes has significant complications. It affects basically every organ in your body from head to toe. You've got cardiovascular disease, so that encompasses heart disease and stroke, heart attack, nerve damage, also known as neuropathy. And I have to tell you that patients who have neuropathy complain of numbness and tingling in the feet, and there is no cure for it. Once you have it, it's there. The damage is done. And basically, all we can do is try and lessen the progression of it. There's no medication to cure it. We have to manage the diabetes from a medical point of view and from a nutritional point of view, but that neuropathy is there. And we have medications that we may prescribe for symptom relief, but I can tell you that those medications also have side effects, and really they have a really limited benefit in terms of reducing that nerve damage. You have to protect your kidneys. This is one of the most important organs in the body. Glucose is very damaging to the kidney and may lead to release of protein, which is not normal, as well as end-stage kidney disease and dialysis. With the eyes, one can develop retinopathy, leading cause of blindness. There are skin conditions, as I discussed in one of the earlier slides. Alzheimer's disease is associated with diabetes, as is other forms of dementia, such as vascular dementia. And we also have to keep in mind effect on mental health, anxiety, and depression. I can state from my own practice, I see many patients with diabetes, and managing their mood conditions is certainly, I would have to say, higher than average and than the average population. Next, please. So how prevalent is it in Canada? This is looking at information from 2019 and predictions towards 2029. And so currently in Canada, they're combining both type 1 and type 2. Now, type 1 diabetes are individuals who do not have any insulin production at all. So they require insulin by injection. Type 2s are the ones that typically require diet and medication to control their diabetes. So right now there's over 3.6 million Canadians with type 1 and type 2, representing approximately 9% of the population. And it's estimated that by 2029, we're up to almost 5 million, or 11% of the population. Now, in my own practice, my estimate is approximately 12 to 15% of the patients that I see have diabetes. That's pretty significant, and the numbers are growing. So much of my time in chronic disease management in my office is managing diabetes and all of the complications, try to prevent the complications, trying to keep the patients healthy as much as possible. So here you see the next bullet point, type 1 diabetes is much smaller than type 2, 5 to 10% of the prevalence. And our focus here is more so going to be on the type 2 diabetic population. What we need to know also, as I mentioned before, are the number of undiagnosed type 2s. So people that have type 2 diabetes, excuse me, and are not aware because they haven't gone to the doctor, their blood glucose hasn't been checked, because they're not having any symptoms yet. So this can go on for years without any knowledge. And again, the pre-diabetes, so where someone has a fasting glucose between 6.1 and 6.9, we're looking at almost 11 million Canadians are 29% of the population and increasing to over 13 million estimated by 2029. Diabetes is very, very expensive. For type 1, to be on insulin, we're looking at approximately $1,100 to $2,600 per year for insulin treatment. If you're on a pump, we got some beautiful high-tech, pumps. They do a fantastic job. They release insulin on a scheduled basis based on the blood glucose level. It can cost almost $5,000 a year for someone on a pump. And if you're type 2 taking medication, you're looking at almost $2,000 a year, or perhaps even more. We have new classes of medications, the GLP-1 agonists, which are most of which are injectable, although there's now an oral GLP-1 agonist. They are super medications that lower glucose quite well. They are very effective at reducing weight, but I'll tell you, they are very, very expensive. But because they're effective, most formularies have started to cover them, including Ontario's drug benefit formulary, which was quite a surprise over the last year when one of the medications became listed, and we're looking at about $300 a month just for that one medication. Next slide. So diabetes has a huge impact on the health of Canadians. Leading cause of premature death, you're looking at lifespan reduction by 5 to 15 years. Of course, if your diabetes is managed, you could lead a perfectly normal life, but should your diabetes not be controlled, you will suffer the consequences. This is virtually guaranteed. At least one out of every 10 deaths in Canada is attributable to diabetes between the years 2008 and 2009. You're more likely to be hospitalized, 3 times more likely with cardiovascular disease, so that's heart attack and stroke. More likely, significantly more likely to end up with end-stage renal disease, 20 times more likely to lose a limb, so amputation. Is most common cause of amputation is in the diabetic population. I've seen it with with my own patients who have not been able to achieve control. So 30% of strokes, 40% of heart attacks, 50% of kidney failure requiring dialysis. Ending up on dialysis is basically a death sentence. You will spend your life at a dialysis unit at least 3 times a week for many hours a day. And ultimately you will succumb. That is, unfortunately, that is the way end-stage renal disease ends up, is with cardiovascular death. Mentioned before, mental health, depression, it's about 30% in diabetes, the prevalence, and those who have depression have an increased risk of developing type 2 diabetes. Blindness, 25 times higher in diabetics versus non-diabetics. Leading cause of blindness under the age of 50, and over 500,000 Canadians have diabetic retinopathy. So that means is regular visits to the ophthalmologist, laser treatments with effect on their vision. And here, foot ulcerations. So one of the things that when a physician practitioner is managing their diabetic patients, we examine their feet on a regular basis, at least once or twice a year, because the development of foot ulcers is quite common. And once you get an ulcer, and this is often due to vascular disease because the blood flow is reduced, the wounds that develop in the feet don't heal. And when they don't heal, they also get infected, and that increases risk of toe or limb amputation. And as you see here, 1/3 of amputations in 2011 to 2012 were performed on people with a diabetic foot wound, and I have seen this with my own patients. So Diabetes is it is so significant in the health of Canadians and so expensive on the healthcare system that it it is imperative that we manage this as best as possible to reduce these complications. Next, please. There are certain populations that are more at risk than others. It does not treat all populations equally. So in African, Arab, Asian, Hispanic, and Indigenous South Asians, higher risk of diabetes, lower income, often due to poor nutrition, food poverty, significant risk factors. First Nations, much higher incidence of diabetes, and with the barriers in care for Indigenous, I mean, adequate water is not even available. Managing diabetes is going to be that much more difficult for the Indigenous population. We talked about the medication being very expensive. Other issues, hypoglycemia and hyperglycemia. So hypoglycemia would be low blood sugar. So this is a risk often from certain medications. This can be quite significant. So we have to teach our patients on how to manage hypoglycemia because that can be life-threatening. People end up in hospital with with hypoglycemic coma. And the same token, very elevated blood sugar can cause other problems requiring hospitalization, such as a condition called ketoacidosis when the blood glucose is too high. Next slide. So there are different policies within Canada to support healthy eating. We do have the Canada's Food Guide, which did receive a revamp in the last year or so. It's an improvement from the old Canada's Food Guide, but I still think it needs some work. Jane would be better able to speak to that. Restricting unhealthy foods and beverages to children. I'm not sure how well Canada is doing at this at the moment. Labeling, we have labeling in Canada to identify, carbohydrate, fats. This is all on the label, but people need to know how to read the labels. And quite frankly, I find that most people don't know how to read the label. And really, we do need to increase access to nutritious food. Unfortunately, marketing is still very significant for non-nutritious foods. Non-nutritious foods tend to be more inexpensive and heavily advertised, and this is leading to poorer health within the populations all over the world, but particularly within North America. Next, please. So we have these challenges. We have to deal with the increasing prevalence of diabetes and identifying those populations who are at increased risk. The risk does increase with age. So we do find that as you get older, insulin resistance tends to increase, particularly if you have that genetic predisposition. So, and also Canadians are not active enough. It's stated that only 46% of Canadians are physically inactive. The majority of Canadians are not eating enough fruits and vegetables. And the incidence of obesity amongst adults is currently approximately 35%. And the youth, it's going up. We do see far more diabetes in youths than we used to. Decades ago, when I began practice, I would never see a teenager with diabetes, but now we are. So this is very significant. And smoking is still an issue, but fortunately it is less than prior decades. So I think we're making a little bit of headway there. Next, please. So what works at this point? I'm going to turn the discussion over to Jane, who's going to lead us through the nutritional discussion in managing diabetes.
Awesome. Thanks, Ira. You did a fabulous job on educating us on type 1 and type 2. So just as a reminder that the type 1 diabetes is the diabetes where people can't produce insulin and people are born with that. But the type 2 diabetes is the diabetes that we can manage. And we could do that through nutrition and through some lifestyle. So obviously there is definitely some nutrition intervention here. So I love this slide because, you know, as a nutritionist, I've been working with clients for years and years and years, trying to get them back on track with really healthy eating. And I kind of came up with this. We live in a world where burger is the king and dairy is the queen. And this is scary stuff. This is basically, we're consuming foods that are much different than we consumed since I was growing up. I remember, you know, I grew up in the 60s. There weren't any children in my school that were overweight. Maybe one of them was overweight, and we were much more active. And we definitely were, even though we were eating lots of white bread and lots of sugar, we were pretty active, and the activity level definitely kept us at bay. And it's important that we understand that the food industry has completely changed, and it's actually brought us what we call the 5 new food groups. So that's frozen, fast, fried, junk, and processed food. You may not think that these are bad, but let's look at these for just a moment. So these foods are usually beige in color. They lack water, they lack fiber, they lack enzymes. I always say that if it comes in a bag, box, pickup window, vending machine, or has a barcode on it, it's probably not food. So we've moved away from that. And yes, our lives have become busier. And yes, moms are trying to put food on the table before they take their kids to hockey and to baseball in the old days. So it was easy for people to grab stuff, but it's just as easy for us also to take some time to manage the food that we're consuming, because really what you eat and how you eat is definitely going to affect your physical body. One habit I used to have was to go in the middle of the afternoon, leave my office and go to Starbucks and get a tea, and always was absolutely amazed at how many children were coming in there buying cookies and these drinks with like 3 or 4 pumps of the sugar. And I thought to myself, this can't possibly be healthy for our younger generation, not to mention for anybody, because as this continuous consumption of sugar, it's increasing and elevating our risk for developing type 2 diabetes. And yes, ladies and gentlemen, size matters. What does this mean? Well, there is an old saying that well, actually, we'll go back to this. The size of our waist is an indicator for the prevalence of diabetes and heart disease and cardiovascular problems. So if you were actually going to take a measuring tape and just stood there, relaxed with your feet together and wrapped it around your abdomen, if you are a male and it measures more than 40 inches or 35 inches for a female, then you definitely will have too much of this fat. We're going to talk about the visceral fat. And this puts you at a much greater risk of developing type 2 diabetes, which is something that we definitely can manage for sure. So you have basically several hormones when it comes to food, when it comes to managing your weight, and they are ghrelin, leptin, insulin, and glucagon. So ghrelin is the hunger hormone, and it goes up before you eat your meals. Leptin is a satiety hormone, so that's the hormone that makes you feel satisfied once you've eaten. Insulin, it moves glucose from the blood into the cells for energy and storage, and it's also known as the fat storage hormone. And then glucagon is stimulated. It stimulates glucose production in the liver, and it maintains adequate glucose concentrations. So all of these hormones have to work in harmony with each other in order for us to maintain a healthy weight, also to prevent us from developing type 2 diabetes. And our diet and our exercise and our lifestyle definitely have an impact. Before we did the webinar tonight, I kind of just went online and I Googled actually I Googled, I'm gonna come back to that. Oh, here it is here. I Googled the term diabetes, And it's derived from the Greek word meaning siphon, to pass through, and mellitus, which is diabetes mellitus, is what it's actually called. It meaning honeyed or sweet. This is because in diabetes, excess sugar is found in the blood and the urine. And as Ira said, these are when he does his testing in his office, he's able to see what these are. So we want to make sure that these hormones are all working adequately, because as the orchestra works, everything works in harmony. And what happens sometimes if we have too much fat in the abdomen, then our leptin, the receptors, get turned off. And when our leptin receptors get turned off, then we never feel satisfied, and we can always feel hungry, and we don't want to feel hungry. And if you want to lower your ghrelin, that's the hunger hormone, then we need to avoid the sugars, and we also need to eat protein at every meal. So we're going to talk about some solutions for that. But right now, I just wanted to kind of educate on understanding the hormones around food and your sugars. So we know that Iris already talked about several of these things that it can cause. So high blood pressure, blood fat abnormalities, abnormal immune system functioning, acne, and who would have thought that acne was part of that? Ankle swelling, constipation, decreased memory or concentration, depression, fatigue, irregular menstrual cycles, irritability, sugar cravings, water retention, weight gain, and especially around the middle. So maybe you have some of these symptoms, and it would be a good idea to have your blood fasting glucose levels checked, or to see your medical doctor to see if you also are at risk of developing type 2 diabetes. So you have basically 4 fats in your body. You've got the brown fat, the white fat, the subcutaneous fat, and the visceral fat. So the brown fat is mostly found in your shoulders, and that brown fat is the fat that keeps us warm, and it turns on when we get cold. Babies are born with lots of brown fat, and that's why they're chubby. The subcutaneous fat, that's the fat that we can pinch at the side of our top of our pants at our waistline. It's unsightly, it's not dangerous, but it does supply your body with, it does supply your skin with some oxygen. Then you have the white fat. It also cushions our organs, and it contains the leptin, and it's also a reserved energy. After you've worked out, you're going to use the energy from your muscle, the energy from your liver, and then it's going to turn into your white fat. So you're never going to get on the treadmill and start to burn your muscles. You're going to start to use and burn your white fat. But the most dangerous fat of all is the visceral fat. We know that this visceral fat, it provokes the inflammatory responses, pathways. It wraps around the organs and causes all kinds of problems. The other thing that's really interesting about the visceral fat, it's also what we call an active fat. And it's stored in the abdominal cavity. It builds up in the arteries, and active means that it increases your risk of health problems. And also, visceral fat is a serious promoter of high blood pressure. So here we have an abdomen with a lot of this visceral fat. And remember, it's dangerous as it's related to the release of proteins and hormones that can cause inflammation. And some of these are called cytokines. So we want to reduce this visceral fat. You can see just physically looking at the abdomen of this gentleman that there's a lot of inflammation. So this inflammation, as the visceral fat, it wraps around the liver, the heart, the pancreas, all the organs, and puts out these inflammation markers into the bloodstream and increases your risk of all of these things that we were speaking about. So what are some of the solutions? One of the solutions that I have been working with for several years right now is a program called Metabolic Balance. And Metabolic Balance is a program designed to reduce inflammation in your body, to balance out your hormones, and help people to lose weight. A program that was created by a German physician, Dr. Wolf Funfack. And Dr. Wolf himself was a diabetic, obese, and a heart surgeon. And after putting another pacemaker into somebody's chest, he realized that he needed to do something to make a change in the world, to bring forth something that can help people with this heart disease, with diabetes, with high blood pressure, with blood lipid disorders. And he came up with a program called Metabolic Balance. Now, metabolic balance is not really a diet. It's really more of a hormone and metabolism regulator, a program that resets your current metabolic function and helps you to use energy and fat at your body's optimal levels. And he has been doing this, and his program is now currently in 35 countries around the world. Metabolic Balance was brought to Canada in 2000 and I believe 8 or 13, I can't remember. But Ira has been the medical advisor for Metabolic Balance, and a lot of plans have been made, and a lot of people have had their lives changed by doing the metabolic program. And the type 2 diabetes often can be eliminated, reduced, and medications can be eliminated or reduced depending on the person. And it offers a great solution to managing type 2 diabetes. Well, how does this program really work? What Dr. Wolf did was he figured out a system that if he were to take your blood values, so the clients come in and we do a full intake. We look at their height, their weight, the size of their waist, the size of their hip, the size of their inner thigh, any medical problems they have, including Parkinson's, diabetes, high blood pressure, asthma, lupus, um, depression, anxiety, hormonal imbalances. So it takes your blood. We do 35 of your blood values. We do this personal health history, and we find out what is the ideal goal for the client. So to either lose weight, to maintain weight, or to gain weight, and also to balance out the hormones, because many people use this to help them become pregnant as well. So the blood is taken at the lab, and then the blood work comes back to Dr. Ira, and then it gets passed on to the practitioner, which in my case would be me. And I take a look at this blood, and then I take this questionnaire, and then what I'm able to do is I input this all into the metabolic balance database, which is in Germany, and every food is matched up with all blood values. So for instance, if a person has a high CRP, which stands for C-reactive protein, this is a level of inflammation in the body, and that level should be below 5. But if this level is very high, Metabolic Balance Germany is going to give you foods that are low inflammatory. But it is a perfect balance of fat, protein, and carbs. It's not high fat, it's not high carb, it's not low carb. It's a perfect balance of fat, protein, and carb based on each person's individual biochemistry and each person's health history. So I can do a plan for somebody who's 20 and has no problems, or I could do a plan for somebody who's 80 years old and is on 4 medications, has their gallbladder removed, whatever. Each plan is individualized and customized based on the person's health history, which is so unique. So, which means there are no 2 plans created. And what happens then, all this information gets filtered into the Metabolic Balance website. And then what happens is they give us food that's the perfect balance of protein, fats, and carbs. So you might be thinking, well, I'm going to starve or I'm not going to feel good. This is not the case at all because you actually get quite a bit of food. So every plan has been created to give you the optimal nutrition for that individual person. So it generates a list of food. So on a person's plan, we will get a list of all the proteins and we'll get a list of all the carbohydrates. So for instance, you might get a list saying cheese, and maybe you've got goat cheese and you've got Swiss cheese and you've got sheep's cream cheese, and that's the only cheese you're allowed. And maybe if you've got asthma, all that's going to be taken out. And then so you'll get a list of your cheese, your meat, your eggs, how many eggs you can have. But also the beauty of Metabolic Balance, it also allows the client to take food off their plan. So I have a lot of people who don't eat fish. I have a lot of people who have a nut allergy. I have a lot of people who are allergic to certain legumes. So we're able to take those foods off their plan, but it can't add things back on the plan. So they're going to get the best list of foods based on their biochemistry, based on their personal health history, to give them the optimal plan to help them to lose weight, to balance out their hormones, and to maintain, to get them to their goal. Metabolic Balance has 8 fundamental rules, and Dr. Wolf, what he did was he created metabolic balance to change the way insulin works in your body. Now, remember, we already talked about what insulin is. We know that insulin is a fat storage hormone. And if we change the way insulin works in your body, then we can get you to your optimal weight and reduce the inflammatory markers in your body and hopefully manage some of the symptoms that you're experiencing and some of the medical issues that you're having at the current time. So the first rule, and these are cardinal rules for all clients who go on the program, and my clients who just start these rules today can lose between 3 and 5 pounds in a very short period of time because it resets your metabolism in a very holistic, natural way without you having to make a lot of changes. So 3 meals a day. Why? Because you want a constant influx of food into your system so that your blood sugars are always staying normal. Lots of my clients come in and say, well, I don't eat to 2 o'clock. I intermittent fast. The problem with that, though, unless you're doing it properly, the hazard is that when you get off your intermittent fast, you tend to overeat or you don't actually consume the right food at the right amounts. So people often overeat in the evening and then they're not hungry in the morning and they start this vicious cycle and they notice they start putting fat around the abdomen. And we know that's the visceral fat, and that's because insulin is out of balance here. The second rule is we have to take a break of at least 5 hours before your next meal. Why? Because when you eat more 5 to 6 times a day, insulin levels are gonna be high. And if insulin levels are always high, you're gonna get into fat storage versus fat burning. So it's really important that we wait 5 hours between meals, which means there's absolutely no snacking allowed. When you start to follow these rules, you will find that your requirement for snacking drops almost completely. And not to mention, your sugar cravings and your salt cravings can go away as well. The maximum amount of time that we can wait between meals is 7 hours. So if you had breakfast at 8 o'clock in the morning and you finished at 8:15, then you're not having lunch till 1:15, and then your dinner can be 7:15. But the latest you can eat is 9 o'clock in the evening. You don't want to, number three, you don't want to allow any meal to last longer than 60 minutes. Why? Because if you're eating past 60 minutes, insulin is elevated. Remember, insulin is a fat storage hormone. And why do we have this rule here? Because many of us have dinner and then we go back into the kitchen and we get a cookie and then we go back and get some chips and we go back and get a coffee, we go get a glass of wine, we go get something. And so insulin levels are high all evening and we can't possibly lose weight or balance our hormones or reduce inflammation if we're eating past the 60 minutes. Number four is to begin each meal with 2 bites of protein. This is a really big rule for metabolic balance participants. When you eat 2 bites of protein, you release the hormone called glucagon and not insulin. And we know that glucagon is an antagonist of insulin. The other thing is when you have 2 bites of protein, you instantly feel satisfied. There's a hormone that goes off in your brain that says you're going to be good. So if you're going to a party in the old days, if you had a piece of cheese before you left the house, you're going to be more satisfied. But if you had some celery or an apple before you left the house, you're going to be really hungry. So if you have these 2 bites of protein, it makes you feel much more satisfied and it releases glucagon, which is an antagonist of insulin. Number five is one protein per meal and choose 3 different proteins for each meal. Why do we only want one protein per meal? Well, let me give you an example. The biological value of an egg is 100%, which means if I eat the egg, I'm going to be able to make human protein very quickly. But the biological value of milk is 91%. What does this mean? It means that protein is made up of amino acids, and amino acids are the building blocks of protein. But when you combine 2 different proteins, egg being 100% and milk being 91%, the body can take only the amount of amino acids from the lowest amount of biological valued food, which is going to be the milk. That's going to leave us over with 9%, and this is going to lead us to being over acid. And it's very difficult for a person to lose weight if their body's in an over acid state. So it's important that we only have one protein per meal. And you know that when you went to a buffet and you had a little bit of chicken, a little bit of fish, a little bit of cheesecake, you walked out of that restaurant feeling bloated and stuffed, and the food stayed in your stomach for a long time. And the other part of that is eating 3 different protein groups a day. So we don't want to have chicken for lunch and chicken for dinner. We do want to make sure that we're consuming foods from all the food categories And one of the habits that most humans fall into is that we do consume same 11 foods every day, and we wonder why we can't shift the body weight or remove that visceral fat off our tummy. The next rule is don't eat after 9 o'clock. We all know that your metabolism starts to slow down in the evening, so it's best to finish your meal after 9 o'clock. Now, I've got lots of clients who are in shift work, so we just completely switch it over for them. Drink 35 milliliters of water per kilogram of body weight a day. That basically turns out to be roughly between 2 and 4 liters of water a day. Lots of people are dehydrated. Your body is 75% water. And the beauty of this program is that when people start to drink the water, start to follow the rules, start to eat this food, they can lose between 5 and 20 pounds in the first 2 weeks. And I've seen that over and over again. And then the last rule is to have one apple a day. The reason the apple that Dr. Wolf put on here is there is no other fruit that has the same amounts of vitamins and minerals and enzymes like the apple, and it also lowers your uric acid and it lowers your cholesterol. And the apple that was recommended on this program in Canada is a Granny Smith or a Macintosh, a Braeburn, Ida Red, Jonathan, and Gravensteiner. Those are more of the German fruits, but in Canada and the US, we mostly use the Macintosh and the Granny Smith apples. So what happens after the client comes in, they do their blood work, they fill out that questionnaire. I send this information to Germany. Ira reviews the blood work, and in some cases, we've had to do further testing for some of the patients because we need to, in order for us to make a plan, we just need to make sure that things are in the rightful place. So each client will receive a template that will look similar to this. Let me just explain to you. Metabolic balance has 4 phases to it. So phase 1, we do a cleanse with each client. They receive a package to make them go to the washroom on the first day, and they will be given a choice of either fruit, vegetables, potato, rice, or potatoes. Now, if their blood fasting glucose levels are high, or if they're diabetic, they will not be allowed to have fruit for the first 2 days of their cleanse because we know the sugars are going to elevate the blood glucose. So that would be taken off. Most people will consume either the rice or the potatoes, and they have an alternate choice of having half their normal breakfast, a soup, uh, a soup and an apple at lunchtime, and then dinner they can have a big plate of vegetables. All food has to be measured, and they are provided with a food scale. Because remember, this is an exact science of protein, fats, and carbs. And if we look at this person's plan, you can see that they have 225 grams of yogurt for breakfast, fruit, and bread. And actually, if you go down this list, there's bread, 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 fruit, fruit, fruit. And everybody comes, oh my God, fruit's fattening, bread is fattening, these are carbohydrates. These are the right carbohydrates. These are the carbohydrates your body wants. The combination of the protein, fats, and carbs gives you a level of insulin in your body that is more stable. When you go in the morning and you have a coffee and a bagel, your sugars are going to go up and down like this all day. What we're trying to do with metabolic balance is to flatline your sugar so that you go from breakfast to lunch without starving and lunch to dinner without starving, so that there's not those moments where you have ravenous hunger. And you're going to get ravenous hunger if you're eating the 5 new food groups, or if you're not getting your protein, or if you're missing meals, and then you tend to overeat. So the bread on this plan is 100% rye bread. Of course, it's a German bread, and it's very dense, which means it has a low glycemic index. What does that mean? It means food either burns like fast or slow. Food burns like straw or it burns like coal. What we're giving you on this program is food that burns like coal, something that's going to stay in your tummy for a long time so you feel satiated. So your tendency is when you have your protein and fats, carbs met, your cravings literally almost overnight disappear from sugar and from salt because you feel satisfied. Have you ever had dinner and then you go into the freezer and you get a skinny cow? You know, those ice cream bars that are like, I don't even know, maybe they're fat free, but you don't feel satisfied. So you go get another one, another one, another one. If I personally have ice cream, I'm going for a full fat Haagen-Dazs, and I'm going to feel satisfied on a very low amount of this, which reminds me of a client I had who I put on the program, and his plan looks similar to this. He came to me because he had just lost his big toe. His big toe was amputated because his sugars were so high, And as Ira said, he didn't realize that he had diabetes, and they had to amputate his big toe. So you can imagine the difficulties that he went through to walk. But what was fascinating about him is when we gave him a food plan like this, when he went back to the wound doctor at the diabetic center, they could not believe how fast the toe had healed, because over and over and over again, any amputations, all of this, because of the lack of the circulation, it takes an incredible amount of time for these wounds to heal. His toe healed up so fast, he was able to get off his medication, he was able to restore his life. He actually started the program, and the first day 3 of his program after the cleanse, he actually went to a wedding and he took his own food. So he was 100% convinced and wanted to get himself better. And today he is completely healthy and he has no signs of type 2 diabetes anymore. So it's really important. So you get this plan. Each person can, you can move food around, but you can't take something out of one box and move it to the other box. So for instance, I can't take the vegetables out here and put it over here. I must make sure that I just eat what's in here. But the bread is, you don't have to eat the bread if you don't want to, but you do have to have 1 apple a day. And then you've got these other fruits. And you may be wondering, because some of you may be on the program right now, some of the fruits that are on the plan across the board, across the world, are apples, mangoes, and papayas. And yes, they are high in sugar and they're dense. But the reason the the mango and the papaya primarily are on there because they contain a lot of digestive enzymes and they really help to heal the gut. So that looks like that's a template. And you can see here that we've got the 5 hours between meals. And in the evening, this person was not given any fruit. However, this person can switch this meal for this meal, and I tell them how they can make the changes. So they get a template. They're going to follow this food guide after they do their 2-day cleanse. They're going to be eating just this food. They're going to be cooking only with water and vegetable broth. There is no added oil. Don't worry about the fat because you got lots of fat in your cheese. You got lots of fat in your avocados. You got lots of fat in your fish and your poultry. That's not a concern. So we eat this way for 14 days after the 2-day cleanse. And yes, the cleanse can be, no, it's not going to be easy sometimes, but it's really good to do that because it helps to reset the metabolism. We do this for 14 days. And then on day 16, the client comes back in and we give them 3 tablespoons of oil, an hour of exercise a day, and 1 treat meal a week. Because in the real world, we are going to live and we want to have some fun. So they can go eat and drink whatever they want. A lot of them come back and say to me, they feel terrible because they've had such a clean diet for the last 16 days and they never want to eat that food again. So they now know what they want to do for their treat meal, and they will continue to follow in phase 2. They will continue to eat this food until they reach their desired goal. When they reach their desired goal, we will put them into phase 3 and they'll get a new list of foods. Plus, they'll have some restrictions lifted and they'll be able to add some pasta or potatoes at lunchtime, and they'll be able to increase their carbohydrates and their protein at lunchtime. But we still have to adhere to the 8 rules. And when the client gets to their goal weight, and I just had one today, she's already lost 44 pounds. It didn't take her very long, 3.5 months to get there. She's now in phase 4. So she'll have a metabolic balanced breakfast, a metabolic balanced lunch. She'll still follow the rules and she can lighten up on the dinner. However, she does need to weigh herself once or twice a week, or he, to make sure that her weight has been maintained. Now, the other thing is what's really wonderful about the program is fatigue is pretty much disappears. Energy goes up. People sleep better. They feel better. Their skin clears up. They feel like a brand new person because the body chemistry is working the way nature intended it. So they don't want to go back to this. When they get to their goal, they're able to maintain their weight through exercise. And I might say that in the beginning of the program, it's discouraged for anybody to have exercise in the first 2 weeks because it's very difficult to lose weight with the amount of calories given in the first 2 weeks, and plus your body's also detoxing. So we actually, it sounds counterintuitive, but we actually don't encourage them to exercise. I had a client last week who was exercising for the first 2 weeks. She didn't lose a single pound. After 16 days on the plan, she complained. I said, you got to stop your exercise. Got an email from her yesterday, so I've just lost 10 pounds. So it's kind of crazy. It's good for some people. Those who are addicted to exercise like me, I did the program in the beginning and I backed off the exercise, and I noticed that it was really helpful for me to do that. So that's kind of what a plan looks like. Um, and everybody, as I said, gets their totally different one. So it's real food. It's perfect for you. There's no pills, there's no supplements, there's no shakes, and it's just a wonderful program designed to help your body, and no cravings, which we definitely want to have there. Um, and so that's my kind of little spiel there. What we are going to do right now is we're going to open up the webinar to some questions, that either to Ira or myself. So we're going to unmute you all. Or actually, you're going to unmute yourselves right now if you'd like to. What do you need? Okay. Ira, did you want to say anything in addition to that?
You covered that quite well, Jane.
Thanks.
I have a question.
Okay.
My name is Carrie. Hello.
Hi, Carrie.
Hi. So it's in regards to the recommended 5 to 7 hours in between the meals.
Yes.
So I know that a lot of diabetics are told by their doctors to have sort of smaller, more frequent meals. Like I'm a type 1 diabetic. When I got diagnosed, I was told to have a snack in between each meal. But I know there's a lot of sort of conflicted information, but obviously clients shouldn't, I guess, go against what their doctor is saying. How do you kind of navigate that conversation with them?
So you said you're a type 1 diabetic?
I am, yeah.
Okay, so I'm going to pass that over to Ira.
Okay. But my demographic will be type 2 diabetic, so you can answer from either perspective.
Okay. Ira, you want to take it?
Well, type 1 diabetes can be a little bit more tricky with, with metabolic balance or any diet, because of the insulin requirements are going to be dramatically changing. Anyone with diabetes, even if it's type 2, who's on medication, clients always have to be under the care of their primary care practitioner, because of the the change in insulin resistance in the type 2s that may be coming down. Their medication amounts will be coming down. Now with type 1 diabetes, you just have to be very, very carefully managed and monitored, because the risk of hypoglycemia may be greater, if the insulin is not adjusted downwards as the weight comes down. So the thing about diabetes patients being asked to eat more frequent small meals. So yes, I'm going to say this is a controversial topic. This is something that in my training I heard much of, but it seems a little bit counterintuitive to managing reducing insulin, because this is what we're trying to do in metabolic balance, is reduce insulin.
Yeah.
And if you are eating frequent small meals, if you're eating all the time, then your insulin is always going to be high. And so it's not going to be easy to lose weight if that insulin level is high. So you have to keep that in mind, that in order to lose weight, you do have to drop the insulin. So that's the rationale between the the 5 hours between meals, in order to drop the insulin.
Mm-hmm.
So when I'm counseling my own patients, I advise them also to avoid eating between meals. Sometimes the dietitians will give them different advice. But one thing I will always say is metabolic balance is a nutrition program, and it is not providing medical advice. And I am, as the medical advisor, I am not managing medically the clients of metabolic balance. I am providing support to the coaches and understanding some of the lab work that may come back abnormal, or if they have particular questions. But clients always must defer to their own physician or nurse practitioner, whoever is managing them, regarding medical advice.
For sure. Yeah, no, I appreciate that. That makes complete sense to me, and that's an easy way to explain it to other people, I think. Thank you.
Okay.
Can I ask a question quickly?
Sure.
Would a blood work twice, like, so I don't know the difference between A1C, because you talk about that, and the fasting blood sugar. So if the fasting blood sugar would be when you don't eat at night, you go do a blood test and it comes back. And then what is the A1C?
Okay, so the A1C, the easiest way to describe this is there's a hemoglobin particle in your blood that gets sugar coated. So the higher your blood sugar is, the greater amount of sugar coating there is. So we can measure that sugar coating. And so the A1C is a sort of a barometer of that sugar coating over a 3-month period. And the reason it's 3 months is because the lifespan of a red blood cell is 3 months. And this is actually measuring that sugar coating on a hemoglobin particle. So that's how we come up with the measurements of what's normal. Hemoglobin A1C is based on how high your sugar is. So if your sugar is running high overall, then your A1C is going to be elevated, versus a fasting blood sugar this is what your sugar is at this particular moment in time. It's a snapshot. Right now your sugar is X, versus A1C, it's the trend over a 3-month period. So it tells us what's the global pattern.
So can I ask one more question? So if you should take your blood sugar every day, like every morning you get up, you should take it, and it's giving you different readings. Say you have a 6.4, a 6.8, a 7 in the morning, same time, and then a 5.7 the next time. Would that be considered diabetic then?
So a sugar in the 6 range, fasting, would not be diabetes. That would be pre-diabetes. A fasting sugar over 7.0 and up on more than one occasion would be diagnostic of diabetes. So pre-diabetes, 6.1 to 6.9 fasting. Of course, sugar changes all the time depending on your circumstances, what you've eaten. So you may, you'll never have a sugar that's going to be the fasting sugar that's going to be the same on every morning. But if you're measuring 7.0 and higher more than once, then that is suggestive of diabetes. You're aiming. Your goal is a fasting sugar under 6.0 or up to 6.0.
Anybody else have any more questions?
I actually have a question.
Okay.
Hello, my name is Jahan, and my question is regarding, I hear myself, I'm sorry, it feels like there's a lot of noise. My question is regarding intermittent fasting. You kind of casually mentioned that, and I've been doing that for a good 4 to 5 years. I initially lost, I would say, anywhere between 5 to 8 pounds initially, but didn't lose at the end. And when it comes to diabetes, blood sugars, my A1C and my numbers are well in the healthy range, but I do have the genes for diabetes. So I would like your input on whether I should continue. Is that something that's advisable? I've been doing 16 to 18 hours of no food, and I would limit my meal intake or sugar food intake to 6-hour window. More like one meal and half a snack, like a meal and a half.
So I guess the question is, what is it you're looking for right now?
I'm sorry?
what are you looking for health-wise? Are you trying to maintain your weight? Are you trying to?
Yes, yes. I'm trying to be health conscious, and I'm trying to explore all the diets and what is not really trending as in trending, but what is really making sense and evidence-based. And I would like to make sure, to avoid any trouble in the future. So you did mention intermittent fasting. So I thought that was interesting. If you have
Yeah, you
anything to
know
say
what?
about that.
My feeling about intermittent fasting is if it's done correctly, it can work, but long term, it's hard on the body from a social perspective. And with the metabolic balance program, we do recommend that you do intermittent fasting 2 times a week for a maximum of 14 hours. So if you have dinner at 6 o'clock tonight, you wouldn't eat till 8 o'clock the next day. And we still believe in the 3 meals a day to keep a constant blood sugar levels and to make sure that you're getting all the right nutrients, because it's difficult to get all the meals, all the nutrients in one meal a day and a couple of snacks. So that's kind of my personal feeling about intermittent fasting. And it really depends on if you're doing it the correct way, because a lot of people think they can have coffee on their intermittent fasting, which they can, but it has to be black. So if you wake up in the morning, have a coffee with cream or sugar or whatever, and then you don't eat till 2 o'clock in the afternoon, you haven't done the intermittent fasting properly. So I think you have to listen to your own body and how you're feeling. I know for my clients who do the 3 meals a day with the 2 times intermittent fasting, they feel amazing and they never want to go back to any other type of eating that they did before. So that's kind of where I feel about it, how I feel about it.
Jane, if I can just interrupt for a minute, do you
Sure.
mind if you could just click mute all there's some background noise that it's difficult to hear whoever's speaking.
Yeah. So if you want to speak, then just unmute yourself. There we go. Oh. Are there any other questions? Go back to share. So if that's all, if anybody has any last questions, we can certainly take the questions. Other than that, I'd like to say on behalf of Dr. Ira and myself, thank you for joining us tonight. We have recorded this webinar, so we will be sending that out to you after we finish. And our contact information is there. So if you have any questions, you can certainly reach out to me and I can pass on any information to Ira if you have any other questions. But I would like to say thank you very much for joining us. And Ira, do you have any last words?
It's been a pleasure joining you this evening.
Thank you so much, everybody. Enjoy, stay safe, and eat healthy. Thanks for joining us tonight. Thank you.
Thank you. It was great.
Thank you.
Yeah.
Thank you.
Thank you.